Hello and welcome to the Sisters for Fitness Wellness Show. I'm Stephanie Gaines-Bryant. Our guest today is Dr. Meghan Malentacchi, and she is an OB GYN with the MedStar Medical Group. Today we're talking about something that people don't talk about enough, which is postpartum depression. Welcome.
Thank you so much for having me.
So a lot of times for a lot of women, pregnancy is the most exciting time of your life. This new life is created and you're going to be a mom for the first or second time. It's really an exciting time.
Correct.
Starting a family. You have the baby, and sometimes women go through a depression. So can we define what is postpartum depression?
I think postpartum depression is a category of symptoms that you experience that are similar to symptoms you might experience if you have depression in another part in your life that can really interfere with how you feel about yourself, how you're able to take care of yourself, and how you're able to take care of your baby.
So are women who have had depression before are more prone to have postpartum depression than others?
Absolutely. One of the strongest risk factors for postpartum depression is either having a previous episode of postpartum depression with a prior birth or having depression or anxiety in the past.
What are some of those symptoms? I know personally I've had 4 children, and so I know what that feels like. What are some of the symptoms that a woman should look for?
Sure. Some of the major symptoms are kind of feelings of sadness, things that you may have enjoyed in the past aren't as enjoyable to you, or things that should be enjoyable, spending time with your baby, might not bring you joy. Also, having trouble sleeping, which is hard because you have a baby, so oftentimes you're not able to sleep normally as you might have been prior. But if you have a chance to sleep and you're not able to sleep, you're extremely exhausted and you just can't find yourself falling asleep, that can be a symptom of depression. Or on the opposite end, if you're just always falling asleep, you're not able to wake up, you're not able to get out of bed, that can be a sign of depression as well. Problems eating, so changes in your eating pattern, you're not hungry at all, you're not wanting to eat, or again on the opposite end of the spectrum, you're wanting to overeat and you're eating to find comfort, that could be also a sign of depression. There's so many. Also feeling kind of anxious or feelings of guilt can also all be signs of depression.
So is this hormonal because your body has just gone through this experience, or is it psychological?
I think it's a combination of factors that all kind of peak in the postpartum period. So there's lots of hormone changes. Your thyroid hormone can change, your estrogen, progesterone levels, those are all changing. You also have lots of stress in your life that you may not have had before. You might not be sleeping normally, you might be adjusting to a very new role in your life. There can be financial stressors. All these things can kind of culminate to lead to postpartum depression. So I would say it's probably a combination of things.
What's usually the treatment? Is it talking to a counselor? Or is it medication? What are some of the options that women have?
I think some of the most effective options are medications, which work very well, and or therapy. And oftentimes if you have a more severe case, we might recommend that you do both of those together.
What is a regular case opposed to a severe case? What would you label a severe case?
I think a severe case would be one that maybe didn't respond to the initial treatment. So we talked about therapy or medication and they were still feeling a lot of the symptoms, and maybe we need to kind of combine the two. Or if it was really interfering with your life to an extreme amount. You weren't really able to do the day-to-day functions that you need to do for yourself or your baby. You're finding you can't even get your baby to the pediatrician visit because you're just feeling so down. That might be more of a severe case.
And in the past we've seen some crime situations where the woman has blamed postpartum depression. Is that something completely different?
I think there is something called postpartum psychosis, which is a very extreme case of postpartum mood disorder. I wouldn't even say necessarily it's just depression, it's kind of its own thing, where moms can hear hallucinations, they can hear voices telling them to do things, and they can just really not be themselves. So I think that it is a true illness. Fortunately, it is uncommon.
How long does postpartum depression last? Is it something that takes a couple of weeks to get through, or is it something that might last a year or more?
Sure. Well, initially when most moms have their babies, or have the birth, there is always a little bit of kind of adjustment after that can occur for most women. We usually call that postpartum blues. It's a more mild presentation where you're just kind of, you might find yourself a little tearful, but you're able to do what you need to do, and it kind of resolves on its own after about a week or two. If we do feel that you have depression, then the length that it will last really varies for everybody. Some people, if you get treatment, oftentimes you can get it under control very quickly within a few weeks. If you don't treat it, you don't seek treatment, it's hard to say. It could last for 6 months, it could last for a year, or it could really become a lifelong problem.
We see nowadays that women are having their children later. So would age be a factor in that? If you're a younger mother, are you more prone, or if you're an older mother, are you more prone?
Sure. I think actually it seems that younger mothers do have a little bit higher tendency of having postpartum depression, but really it can affect anybody of any age. I think one of the reasons it might be more of a struggle for very, very young women is because sometimes they also have other stressors in their life, financial stressors, social stressors, things like that, that can also contribute. But it really can affect anybody at any age.
What about women who already have children? Are you more likely, because I know I had it more during my second pregnancy, which was a twin pregnancy.
Oh my goodness.
Than with the first pregnancy. And then I had the nerve to have a fourth one after that. But is each pregnancy different when it comes to postpartum depression?
Each pregnancy is different, absolutely. The symptoms you feel during pregnancy are very different. I have patients all the time saying, I didn't feel this with my last pregnancy, this pain or this, and each pregnancy is very unique. But depression, if you did have it with the first one, you definitely are high risk for having it with the second one. If you didn't have it with your first one, you definitely could experience it with your second one, because you have additional stressors as well. Besides one new baby, you have perhaps a toddler or a young child that you're also taking care of, so there's additional stress that can
not every woman goes through this. What do you see in your practice? Do you see most women have a little bit of the baby blues, or do you see most women go through something just because of the natural hormones of having a child?
Absolutely. I think most people experience some type of adjustment period and a little bit of what we talked about earlier, the postpartum blues, which is that kind of really early part right after you have the baby where you can be a little emotional, crying. But I do think that it can, sorry, what was the initial question that you asked?
No, we can.
I got sidetracked on the postpartum blues.
No, I was saying, was it something that every woman?
Oh no, not every woman. I would say the rate, and again, it's a spectrum. So there's more mild cases and more severe cases, but I would say it's about 10% or so that we see where we say officially we would call that postpartum depression.
Now, do men go through postpartum depression?
You know what's funny is when I told my husband I was coming here to speak on this subject, he actually said, I'd read something recently about fathers having postpartum depression, and I can't speak on that. I don't know a lot about it, but I'm sure that is a real thing. It's a stressful time for dads too, trying to help mom, trying to adjust to being a father, financial concerns. Absolutely, I would think that would be a real thing.
What are some of the things that we should tell our partners when it comes to postpartum depression? What message should we give our loved ones during this time?
Sure, I would say that it's good to tell your partner to try to watch out for you, because I tell patients sometimes when I see them in the hospital who we know are high risk for postpartum depression, I'll tell their partner or their support person to say, hey, can you be on the watch out for seeing if so-and-so is not acting like themselves? Because sometimes when you're in the midst of feeling depressed, you don't realize what's going on, and you're so lost in trying to sort with everything that it's nice to have somebody on the outside watching out for you and say, hey, you're not seeming like yourself. Maybe you should go talk to somebody. And also, when you do get are diagnosed with depression, it's nice to have somebody that can kind of support you through it and help you. Hey, if you take your medication, or it's okay that you're feeling down. This is the depression. You're going to get through this.
Do women who have C-sections go through more than women who have a vaginal birth? Is there any
There's different
research on that.
As far as depression, I don't know if there's been a link between those two. Obviously, if you're going through a C-section, you're recovering from a major surgery, as well as all the other new stressors of being a new parent. So I don't know if it specifically will increase your chances of having postpartum depression, but there's definitely extra things you have to worry about after you had a C-section.
And we've got a lot of women out here today who are single mothers, who are going through this by themselves.
Yes.
So it sounds like it's very important to have some sort of support system.
Absolutely. That's one of the biggest risk factors for postpartum depression as well, is not having a close support system built in. So if I see a patient like that who's pregnant, I say, if possible, try to build in support systems before the baby comes, whether it's extended family, your parents, your siblings, friends, people from the community or church. It's good to have them built in so that when you have the baby, you have some supports to help you.
How do you prepare yourself? A lot of times, we see the happy parts of having a baby and giving birth. There are a lot of things that people don't talk about, or a lot of things I didn't know until I had this baby. So how can you prepare yourself better? And there's so much more information out here now than there was 20 years ago. So how can you, especially if you are prone to depression, how can you prepare yourself?
I think some things you can do to prepare yourself is make sure that you have a OB/GYN that you feel comfortable with, that you know that you're going to be able to see after you deliver, and you would feel comfortable talking about any emotional concerns. Make sure ahead of time you've picked out a pediatrician for your baby, so that when you're feeling stressed after birth, it's not something you're struggling to do. And also built in those support systems like we talked about. Maybe have a plan that your sister is going to come over every Tuesday night and give you a couple-hour break, or your mom is going to give you a phone call just to check in every afternoon or something like that. Those can be helpful to prepare.
How important is self-care? Because all of a sudden you're taking care of this baby, or you've got several kids, and you are taking care of everybody, but you're not taking care of yourself.
Right.
They tell you the things to do while you're pregnant, taking your vitamins, doing this, doing that. How do you take care of yourself after?
That's I think something that's very tricky to balance, and something I always encourage my patients to do, because a lot of times you get so wrapped up in taking care of the newborn and trying to take care of things around the house, and if you're married, taking care of your spouse, that you forget how to take care of yourself. So I think that you need to build in time to do something for yourself, even if it's as simple as taking some time to go for a walk, or take an extra long shower or a bath, or go to the mall, or get your nails done or something. You might not have a lot of time, but maybe 20, 30 minutes even can give you a little bit of time to kind of recharge yourself.
A lot of times having children means that you have to have that child and go straight back to work, or you've got a couple of weeks to recover. 12 weeks is not a long time to recover.
And many people don't even get 12 weeks, unfortunately.
Yeah, I remember the first time I got 6 weeks. And there was no place, in the place that I was working, no place to nurse. I mean, so you're rushed back into this work situation, and you've got a lot on your plate. So what's the coping mechanism you should use in that instance?
I always encourage patients to take as much time off as they can financially, and they're able to. But once you're back at work, you have to talk to your employer, and if you are nursing, you have to make sure they provide a time and a space for you to pump, if that's something that you're doing. And the immediate time after you go back to work after having a baby might not be the time to say, hey, I'm going to try and go for that promotion. You might just say, hey, I need to go to work, do my job, but I know that my mind is kind of torn, and half of the time it's at home. So just get through your day and try to get back home and get back into your routine at home as easily as you can.
What do you think employers should know? About, like you said, that is very important. When you get back, be a little easy on yourself.
Absolutely.
Like you said, you
transition.
don't
go. You don't have to go 100%. Although it is difficult with some jobs, because some jobs are either you have to do so much, so it's hard to do that. But if you're able to, transition.
And a lot of times women fear, okay, because I just had this child, this is going to be a strike against me. So I've got to work super hard. I've got to do this and this, and you end up super stressing yourself.
Yeah, absolutely. I mean, I think that you just need to try to balance your role as a mom and as an employee or a worker, and know that there's lots of other moms that do this, and where you work, there's probably other women who have been in the same exact experience, and reach out to them and try to form a relationship with them so that you guys can help each other through.
Now, a lot of times we have our children back to back, so you're just getting over this postpartum depression, and you think you're home free.
Yeah.
Boom.
Yeah.
Next thing you know, second baby's coming.
Yeah. I mean, some women prefer to kind of have it together and get it all through and say, hey, all my kids will be in diapers at once, and then they'll all be out. And for some women, it might be better to space it out. It's really, I think, a personal decision. But if you are able to kind of think ahead what might be best for your family, if you can plan those things out, whether it is having them close or farther apart, that might be a good idea.
Is it more likely if you have your children closer together that you'll have postpartum depression?
I think if you do have other small children at home, it is increased stress, so I think it can increase the chances of having postpartum depression, but not necessarily. Again, everybody's very different.
And we talked about how to talk to your significant other.
Yeah.
You can't explain this to your children, but how do you manage that if you've got other children and you're going through this?
Sure. I mean, I think that it can, if you realize that having postpartum depression can affect your baby and their development as well as your other children, it might help to motivate you to seek help and to realize that, the help, if you do seek help and treatment, that you will improve your symptoms, and that will therefore improve, how your child perceive you and your ability to bond with your children. So it's really important, if you think you might have postpartum depression, or if someone's concerned about you, to go and get evaluated and get help.
Do you think that doctors and the community take this issue as seriously as they should, or is it just kind of, you'll be okay?
Sure. I'd like to think that the medical community does take this very seriously. I know all OB-GYNs were trained to identify patients that have postpartum depression and treat this. But I do think sometimes I've seen some patients come in and they're hesitant to get treatment because they're said, well, my aunt said that if I take medication, it makes me crazy. And I think that that's kind of a unfortunate thing, because depression, just like diabetes and asthma, is a real medical illness, and you would have no hesitation to get treated for your asthma. So I feel like to discourage somebody to get treated for their depression is unfortunate. But I always tell my patients, you know what, you don't have, if this is something that's affecting you, you don't have to share with them that you're getting treatment. You do what you need to do for you and your children, and you can talk to them about certain things, but if you don't want to share this with them, that's fine.
At what point do you say, hey, I really need to do something more about this? Or what happens if you go beyond that year?
Sure. I mean, if you go beyond that year, the natural course of depression is different for everybody. So it could be something that kind of self-resolves over time, but it also could be something that trickles into beyond a year, and you're at your child's 2 years and you've still been feeling depressed. So I think that the point to get to help is as early as possible. So if you have any doubts in your mind that what you're feeling might be postpartum depression or might be unusual or different, talk to somebody about it.
A lot of times we see the people from Hollywood and they have their baby and 2 weeks later their body is perfect.
Sure.
They look perfect.
Sure.
What expectations should we have as just normal women about getting back to our normal?
Sure. I would say that give yourself a break and give yourself plenty of time to transition back to your pre-pregnancy body and all this pressures that we get on us, and give yourself time. There's lots of hormone changes that are going on, and these things affect your ability to lose weight and things like this. So just give yourself some time. And I think nowadays too, a lot of people in Hollywood there is some women who are showing more of the reality of things. You don't always get a chance to put your makeup on, your hair is not done, you may not have even showered that day, and that's okay, and that's normal, and you push through. And if you are feeling that it's beyond just the stressors of having a new baby and you're feeling depressed, you go in and see somebody.
I was watching a program the other day, and in these tabloid magazines as well, they were saying, okay, Beyonce's pregnant again.
Poor Beyonce.
Yes. So anyway, she finally came out and said that she has a baby bump. She just had twins.
Sure.
And she said she's not rushing to do anything about it right now.
Good for her.
And
yeah.
guess what? That's okay.
Yeah, I think that's great because I feel like other people, lots of people look up to Beyonce, and to have her say that other people would be more comfortable being who they are and not being as embarrassed or as ashamed that they also have a bump. I mean, who really doesn't leave the hospital with a baby bump?
Exactly, exactly. And sometimes it doesn't go away, you know, the next day.
Right.
And especially if you've got a lot of stressors on you, if you can't do anything about it right away. You've got children, you got to go back to work. You've got to take care of this new baby along with your other children.
Right.
And what I'm saying is, can you be kinder? Can you be more kind to yourself?
I say that too. I think that as a physician, we can remind them to be kind to themselves. As women in the community, we can tell other new moms to be kind to themselves. I think that's really important.
What other issues do you see women going through after that baby comes?
Sure. I mean, there's so many issues. There's issues of adjusting to this new role as being a mom, and sometimes it's hard to balance. I'm still, you know, a person. I'm still a friend. I'm still a sister. I'm still a spouse or a girlfriend. I think that's one thing, is kind of a balancing everything. There's also financial stressors. Babies are expensive. Diapers are expensive. Formula, clothes, all these things. So that's something that's a challenge. Self-image is another thing. A lot of women are, like we spoke about, very harsh on themselves, that they're not immediately back to the appearance that they were before they had the baby. So again, it's just a matter of, I think, supporting each other and helping each other to realize this is normal, and to give yourself some time and reach out for help when you need it.
And I think society should be more understanding as
Sure.
well, as this is a major experience
Yes.
that we go through as women, whether you go through it at the age of 21 or whether you go through it at 41. It is a major change.
Absolutely.
And,
Absolutely.
and we need some consideration.
Absolutely. It's important to have some sympathy from people around you, and not so much sympathy, but understanding and support.
Oh yeah, I remember with my first child, for example, my mom came for 2 weeks, and then my mother-in-law, and
Sure.
you know, so all these people were coming
That's
to
wonderful.
help with the new baby. But the second time around, I didn't have.
And that's probably when you needed it even more so.
Yes. And so I just felt very alone. And I know that's why I really
Sure.
wanted to do this show as well. I know there are a lot of women who just feel alone in this, and they're not.
Right. And there's a lot of other supports that you can find. For example, there's a lot of mom groups. I had a cousin of mine who was telling me about something called, I think it's called, each city has something called Moms Club, and it's through Facebook, and it's a group of moms who get together and they join this group together and they support one another. For example, when one of the members has a newborn, the other ones will come over and bring them meals and help them through that time. They'll also set up meetup groups, play groups, things like that. So if you don't have a lot of support if you don't have family nearby, or you don't have a support person, it is something else that you can look through on social media to find other moms.
I am so glad you brought that up, because that is very important, not just to have the support of your significant other or of immediate family, but other women. Have a circle of other women that you can just be.
Absolutely, absolutely. Because no one will kind of know what you're going through as well as another mom with a newborn might. So, and you can kind of bounce things off each other too, and say, "Oh, you feel that way too? Okay, this is normal," and it's not unusual that I'm still have a baby bump, or that I'm I've gone a day without taking a shower or something like that.
And then they, like you said, they understand things, or other mothers understand things in a way that you don't. Also, play groups, like you said, it's so important to see other people, not to confine yourself, to be able to see other people, to interact, especially with other women.
Sure. And another good idea is, if you have another couple or a friend that has a newborn, sometimes to do kind of swap out. So I'll watch the 2 kids tonight, and you go do something for yourself, and then I'll return the favor next week, and that can be helpful as well.
Especially if you're in a marriage situation, to see yourself as individuals. You're not just mommy and daddy.
Right.
you
Right.
have names,
Mm-hmm.
you
Yep.
know, and to talk adult talk sometimes
Absolutely.
instead of baby talk.
Absolutely.
Because a lot of times that's what'll break couples up, the financial stresses of a new baby, the responsibility of the new baby. Your husband's not the focus of your life as much anymore. You've got these other things you need to pay attention to, and doing that balancing as well as him being or her being more understanding.
Right, right. Yeah, you have to understand that the priorities will change a little bit and have to be adjusted, but it is important to make time for yourself as a couple, as an individual, as a friend, and to do all those things as well. And to give yourself some time. Say, hey, this might be a rough year. We might not be able to do our vacation that we usually do, but you know, we're gonna work through this together, and then, you know, perhaps in a few years we can get back to some of the things we may have done more before.
In wrapping up our discussion, what's
Sure.
your best recommendation?
My best recommendation is, if you know, back to the postpartum depression that we were speaking of earlier, if you have any doubts that what you're feeling might be not normal, please seek help. And before you have a baby, try and build in those support systems as well, like we spoke about. That's really important.
You're right. You're right. And a lot of times people will say, well, I wasn't expecting this pregnancy. But once you are, you need to build a support, because
Right.
you're going to need.
Right. And if possible, try to plan as much ahead of time, especially if you have a history of depression, to build in those support systems, to get as many people on the lookout for you as you possibly can before the baby comes. Because once the baby comes, you don't have as much time as you would like.
And as you mentioned too, you said that sometimes it's a balance of psychological stuff and hormonal stuff.
Absolutely.
Understand that you are going through some hormonal issues.
Right. Give yourself a break. And when I was training once, I had a psychiatrist tell me that one thing that was, you know, really unusual about depression as an illness is it's an illness that can tell you lies about yourself. And you can have lots of negative thoughts in your mind that you think are reality, but in reality they're not necessarily the case, and sometimes it's the depression telling you those things. So sometimes thinking of it that way can give you just that little extra help you need to go seek some help and realize maybe what I'm feeling isn't true. Maybe I'm not, you know, a terrible mom. Maybe it's just the depression that's making me feel this way.
Oh yeah, we just self-talk or negative
Absolutely.
self-talk.
It's definitely a real thing.
Thank you for joining us.
Thank you so much for having me. Thank you.
So you deliver babies, you talk about postpartum depression, and you deal with women with OB/GYN.
Absolutely, yes. Yeah.
And do you have children?
I do. I have one son. He's 16 months right now.
So you've got a full plate. You've got the plate that we've just been talking about that's full of work and responsibilities and parenthood and all that.
I'll tell you, having had a baby, I do have a whole new understanding for some of these things that we've been talking about today. It gives me a self-education that you can't get in medical school.
Dr. Meghan Malentacchi.
Yes.
It has been an absolute pleasure.
Likewise.
And so I just wanted to make sure that as many women as possible could hear this so we could get the word out.
Right, and know you're not alone, and the way you feel, many women before you and after you will feel similar, and there's lots of help out there.
Yes, there is.
Yes.
Where for our moms, it wasn't as much help. It was just kind of like deal with it. So
That's
now it seems like
unfortunate.
it's much more of an understanding
Absolutely, yes.
with what's going on.
You're not alone. Yeah.
Yes. Thank you so much
Thank
for
you.
joining us today.
Thank you.
You've been watching the Sisters for Fitness Wellness Show. Dr. Meghan Malentacchi. I keep saying that because it's a catchy last name.
It's a mouthful, right?
And she's with the MedStar Medical Group. We've been talking about postpartum depression. Thanks so much for joining us. I'm Stephanie Gaines-Bryant. Have a great day.